to TV5 News at 9. It is time now for Aging in Style. Joining us today is Dr. Norman Chapin, Chief Medical Officer at McLaren. Thank you, Dr. Chapin, for joining us this morning and calling in.
You're welcome. It's nice to be here.
Thank you. First, Dr. Chapin, what is McLaren doing to actually keep your patients safe?
Well, I think McLaren has been doing many things since the beginning of the pandemic. I think right now we're focused, as always, on patient safety, and we're really trying to achieve three main ways of keeping patients safe. The first and foremost is we're screening every single person that enters our facilities, whether it's a physician's office or the hospital. Secondly, we've obviously expanded and improved our, I'm going to rephrase that just a second. The second thing that we've done is we've established a way to cohort all of our patients. We're immediately isolating patients who present to the emergency department, for example, with COVID symptoms, and we're treating them on special units to limit the exposure of the rest of the hospital. And the third thing is we have included new methods and cleaning solutions that specifically attack the SARS-CoV-2 virus in our operating rooms, procedure rooms, and all of the floors across the hospital, just to make sure that we are effectively reducing the risk of the virus being able to survive on surfaces throughout the hospital.
Dr. Chapin, a lot of people want to know this. Are we finally being able to see the curve flatten in our communities?
I definitely think the curve is flattening. If you look at the indicators of the rate of prevalence of the disease in the community, we've seen a decrease from the peak in the number of new cases. We've seen the mortality rate decline, the number of deaths per day decline across the state and in our region. And we've seen here at McLaren Bay and across the McLaren region in the north, we've seen a daily decrease in the number of admissions, the number of patients who are on ventilators. I think it's also important to remember that we're seeing this decline in new daily cases in spite of the fact that we have more access to testing than we did at the beginning, and we're testing a larger number of people. So I definitely think if you take those factors into consideration, we can definitely say that we are seeing the curve flatten out, and we are seeing a change in how the disease is being transmitted in our community.
And Dr. Chapin, a lot of people want to know this. The big question now, I have a broken leg or I'm presenting symptoms of a heart attack. Is it safe to go to the hospital?
Well, we know that there are situations that require a patient to seek care from their physician or to come to the hospital. And making sure that they can receive that care when it's absolutely necessary is one of our main priorities. So as I mentioned before, we are doing everything that we possibly can. I would say that we can definitely keep patients safe when they need to seek care for care that is not related to COVID, because of those things that I mentioned earlier in terms of the cohorting process that we have, sequestering patients who have COVID, making sure that all of our employees are using proper PPE and are being screened. We definitely feel confident that we can prevent an exposure of a patient while they're here at the hospital.
Thank you, Doctor. Now, with the discussion of guidelines beginning to be lifted, will individuals who have been waiting to receive care be able to get that care?
Definitely. Yes, we are in the process right now of preparing for those restrictions to be lifted. We are seeing the curve flatten, as you know, and there's been a lot more conversation about how we will provide safe care, because we know that SARS-CoV-2, the coronavirus, will be in our community. And in order to make sure that we can adequately return to more normal operations, we have developed as a corporation what we call the roadmap to safely resume care. We've partnered with other McLaren facilities, with the CDC guidelines, the Michigan Department of Health and Human Services guidelines, and other professional organizations to craft a carefully designed plan to help us safely ramp back up so that eventually, when the restrictions are lifted and people can resume elective surgeries in our outpatient departments, they can be guaranteed that they will have a safe experience and will not run the risk of any type of exposure to coronavirus by coming to the hospital for care that they have.
Doctor, during this pandemic, this new normal that we're going through, anything that we haven't covered that you'd like people out there to know?
Well, I just would like to reiterate that, the hospitals have been providing necessary care using different methods throughout this entire pandemic. And we have seen that some patients have been afraid to come to the hospital for symptoms that might represent a cardiac emergency or a stroke or some other type of serious affection. I really want to stress to people in the community that there are times where staying at home with a potentially life-threatening symptom is not the safest course of action. And if you have a medical emergency or if you need to seek care at the hospital, we will do everything possible to prevent you from an exposure to coronavirus, even though we know that there are coronavirus patients suffering from COVID infections who are here at the hospital. But that should not cause patients to remain at home while they are having a life-threatening emergency.
And that's a great tip. Thank you, Dr. Chapin, for calling in. We appreciate your time today.
Thank you.
You are welcome.
I'm glad I didn't cause any of the technical glitches.
No, you did not at all. If you'd like any more information about today's topic, head on over to the Aging in Style page on WNEM.com.